Good morning, all of you. Today I am Mahendra Saini, Assistant Professor, Department of Pharmacy, Suresh Gyan Vihar University. And today I will discuss about the subject of pathophysiology and topic is nervous system related stroke. First of all, we'll discuss about the learning objectives. Learning objectives of stroke. Based on the content in this chapter, based on the content in this chapter, the reader should be able to introduction of stroke, classification of stroke, types and risk factors of stroke, pathophysiology of stroke, etiology of stroke, sign and symptoms of stroke, examination of stroke, prevention of stroke, management of stroke. These are these are the learning objectives of stroke. Next one is learning outcomes. What are the learning outcomes of stroke? Like by the end of this lecture, by the end of the lecture, the student should be able to understand like introduction of stroke, classification of stroke, types and risk factors of stroke, pathophysiology of stroke, and etiology of stroke, sign and symptoms of stroke, and examination of stroke, and prevention of stroke, and last one is management of stroke. These are the learning outcomes of stroke. First of all, introduction. Introduction of stroke. A stroke occurs when the blood supply. A stroke occurs when the blood supply to part of your brain. Stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissues from getting oxygen and nutrients. Brain cells begins to die a minute. A stroke is a medical emergency and prompt treatment is crucial. Interpreted means to pause or make a break in the continuity of uniformity of something, and crucial, extremely important or involving an externally important decisions. This is the introduction of stroke. In this diagram, these blood vessels are blood clot locked in cerebral arteries causing a stroke, and blood clots break off and travels, and disease carotid arteries, normal carotid arteries. Next one is clinical classification. Clinical classification of stroke. Clinical classification of stroke is further divided in three types. First one is progressing evolving, and second one is complete stroke, and third one is transient ischemic attack. First one is transient ischemic attack, a clinical syndrome of rapid onset of focal deficient of brain functions and which resolve within 24 hours regardless of whether they are imagining evidence of new permanent brain injury. Focal deficiency. Focal deficiency means is a problem with nerve, spinal cord or brain functions is affect a specific location. And second one is progressive stroke. Second one is progressive stroke, in which progressive stroke, a stroke in which focal neurological deficiencies worsen with time. Worsen with time means, and also called stroke in evaluations. And third one type is completed stroke, a stroke in which the focal neurological deficiencies persist and do not worsen with time. Difference between progressive stroke and completed stroke, in which progressive stroke neurological deficit worsen with time, and completed stroke focal neurological deficit percentage do not worsen with time. Next one, types and risk factors of stroke. Types and risk factors of stroke. First one, fixed risk factors. First, fixed stroke risk factors, and second one is modifiable risk factors. And fixed, in which fixed stroke risk factors like age, gender, like male, female, male are more than compared to female, and races, Asian, European. The Asian are more than Europeans. Hereditary, hereditary means genetic, and previous vascular events, example myocardial infarctions, peripheral embolism, high fibrinogens, and second one is modifiable risk factors of stroke like high blood pressure, heart disease, arterial fibrillations, and heart failure, endocarditis. Endocarditis means inflammation in inner layer of heart, diabetes mellitus, hyperlipidemia, smoking, excess alcohol consumptions and oral contraceptives, social deprivations and obesity, sedentary lifestyles. These are the modifiable risk factors for stroke. Next one, types of strokes. Types of stroke. First of all, stroke are two types. First one is ischemic stroke, and next second one is hemorrhagic stroke. 85% stroke is ischemic stroke, and 5% is hemorrhagic stroke. 15% are hemorrhagic stroke, and thrombotic ischemic stroke further divided in two parts like thrombotic ischemic stroke and embolic ischemic stroke. Hemorrhagic stroke further divided in two types, intracerebral hemorrhage, and second one is subarachnoid hemorrhage. Second one is subarachnoid space. Types of stroke, hemorrhagic stroke, ischemic stroke, in which hemorrhagic stroke, blood vessels are ruptured and blood leaks into brain tissues, in which hemorrhagic stroke are blood vessels are ruptured and blood leaks into the brain tissues, and hemorrhagic stroke, bleeding occurs inside or around brain tissues, and in which ischemic stroke, blood clot stops the flow of blood into brain tissues, and then ischemic stroke, a clot blocks blood flow to an area of the brain. Types of stroke. 85% of stroke is ischemic heart stroke, and 15% is hemorrhagic strokes. Pathophysiology. Pathophysiology of ischemic pathophysiology of stroke. Brain requires intracerebral intracerebral hemorrhage, an emergency condition in which a ruptured blood vessels cause bleeding inside the brain, also known as intracerebral hemorrhage, and subarachnoid hemorrhage is most often caused by a crushed blood vessels in the brain, also known as subarachnoid hemorrhage. These are the types of stroke and types of stroke. 85% ischemic stroke and 15% are hemorrhagic stroke. Next one is pathophysiology of stroke. Brain requires constant supply of glucose and oxygen. Brain required constant supply of glucose and oxygen delivered by blood, and brain receive 15% of resting output. Brain receive 50% of resting output and account for 20% of total body oxygen consumption. Total body oxygen consumption only 15% required for the brain receive the 50% resting output and 20% of body oxygen consumptions. Cerebral blood flow is maintained via autoregulation. Cerebral blood flow is maintained via autoregulation, thus the brain is highly aerobic tissues where oxygen is limiting factors. Cerebral blood flow is maintained via autoregulation, thus the brain is highly aerobic tissues where oxygen is limiting factor. And second one is blood flow. If zero leads to that of brain tissues within 4 to 10 minutes, and blood flow of brain is zero, the brain tissues death within 4 to 10 minutes, and less than 16 to 18 ml per 100 gram tissue minimum infection within an hour. Less than 16 to 18 ml per 100 gram tissues per minute infection within an hour, and less than 20 ml per 100 gram tissues per minute ischemic without infections unless prolonged for several hours or a day. Next one is hemorrhagic stroke. Hemorrhagic stroke. There are two types of hemorrhagic stroke. First one is intracerebral hemorrhage and second one is subarachnoid hemorrhage. SAH means subarachnoid hemorrhage and ICH means intracerebral hemorrhage. Higher mortality rate when compared to ischemic state. Intracerebral hemorrhage means an emergency condition in which a ruptured blood vessels cause bleeding inside the brain. And second one is subarachnoid hemorrhage is most often caused by a burst blood vessels in the brain. Highly mortality rate when compared to ischemic stroke. Mortality rate. Mortality rate is a measure of number of death order death rate in a particular population means mortality rate in which intracerebral hemorrhage and this is subarachnoid hemorrhage. Next one, pathophysiology of hemorrhagic stroke. Pathophysiology of hemorrhagic stroke. Explosive entry of blood. Explosive explosive entry of blood into the brain parenchyma structurally disrupts neurons and white matter and white matter fiber tract are split. White matter. White matter is found in the deeper tissues of the brain and immediate cessation of neurological functions. Immediate cessations of neurological functions and expanding hemorrhage can act as a mass lesions and cause further progression of neurological deficiencies. Cause further progression of neurological deficiencies and large hemorrhage can cause transtentorial conning and rapid death. Transtentorial means transtentorial herniation is a type of cerebral herniation. Is the movement of brain tissue from one intracranial compartment to another intracranial compartment, also known as transtentorial coining. Next one is intracerebral hemorrhage. Next one is intracerebral hemorrhage, in which intracerebral hemorrhage results of chronic hypertension. Results of chronic hypertension and small arteries are damaged due to hypertension, in which intracranial hemorrhage, the small arteries are damaged due to the hypertension, and in advanced stage vessels wall A disturbed and leads to leakage. And subarachnoid hemorrhage, in which subarachnoid hemorrhage most common cause is rupture of saccular or berry aneurysm. Most common cause is rupture of saccular or berry aneurysm, and other causes including arteriovenous malformation, angiomas, mycotic aneurysmal rupture, etc., and associated with extremely severe headache, in which subarachnoid hemorrhage. Next one is etiology of ischemic stroke. Etiology of ischemic stroke. First one is thrombotic ischemic stroke, and second one is embolic ischemic stroke, in which thrombotic lacunar stroke, in which lacunar stroke and large vessel thrombosis, hypercoagulable disorders, and in which embolic like artery to artery carotid bifurcation, carotid bifurcations, aortic arc, cardioemboli like arterial fibrillations, myocardial infections, neural thrombosis, bacterial endocarditis, mitral stenosis, paradoxical embolysis, in which embolic stroke. Embolic stroke occurs when a blood clot that forms less wherein the body bags loose and travel to the vein via the bloodstream, and intracranial and intracranial vessels which supplies the front area of the vein in which blood. Thrombotic stroke. Atherosclerosis is the most common pathway. Atherosclerosis is the most common pathology leading to thrombotic occlusion of blood vessels. And second one is lacunar lacunar stroke. Lacunar stroke accounts for 20% of all strokes, results from occlusion of the small deep penetrating arteries of the brain, and thrombosis leads to small cracks known as lanculas, and clinically manifested as lancular syndrome. Next one is embolic stroke, in which embolic stroke, cardiac embolic stroke, and artery to artery embolic stroke, cardiac embolic stroke. Embolus from embolus from the heart gets loaded in intracranial vessels, and MCA most commonly affected. MCM is which is the largest branch of the intracranial arteries, also known as MCM is middle cerebral arteries. MCM is middle cerebral arteries most commonly affected in cardioembolic stroke, in which cardiac embolic stroke and arterial fibrillation is the most common cause. Arterial fibrillation is the most common cause, in which arterial fibrillation and irregular, often rapid heart rate that's commonly cause poor blood flow. And next one is other myocardial infections, prosthetic valves, rheumatic heart disease, in which myocardial infections, a blockage of blood flow to the heart muscles, also known as myocardial infections, in which myocardial infections blood vessels are completely blocked. And next one is prosthetic valves. Prosthetic valves are artificial heart valves. Prosthetic valves means a prosthetic valve means artificial heart valves. And next one is rheumatic heart disease. Rheumatic heart disease, also known as rheumatic heart fever, a disease that can result from an inadequately treated strep throat and scarlet fevers and cause inflammation especially of the heart blood vessels and joints. Next one is artery to artery embolism. Artery to artery embolism. Thrombus formed on athero atherosclerotic plaques get embolized to intracranial vessels. Thrombus formed on atherosclerotic plaques get embolized to the intracranial vessels. And carotid bifurcation. And carotid bifurcation, atherosclerosis is the most common source for artery to artery embolism. Carotid bifurcation means carotid bifurcation, the common carotid artery divided into internal and external carotid arteries. And carotid bifurcation is the common carotid artery divided into internal and external carotid arteries. And atherosclerosis and other aortic arc and vertebral arteries, etc. Sign and symptoms of stroke. Sign and symptoms of stroke, like history. Ask for onset and progression of neurological symptoms. Ask for onset and progression of neurological symptoms, complete stroke or stroke in evaluations, and history of previous transient ischemic attack and history of hypertension, diabetes mellitus, and history of heart conditions like arrhythmias, rheumatic heart disease, and prosthetic valves, history of seizures and migraine, history of anticoagulant therapy, history of oral contraceptive use, and history of any hypercoagulable disorders like sickle cell anemia and polycythemia vera rubra, and substance abuse, cocaine, amphetamines. These are the signs and symptoms of stroke. Next one is examination of a stroke. Examination of a stroke patients, like the neurological the neurological examination is highly variable and depends on the location of the vascular lesion. The neurological examination is highly variable and depends on the location of the vascular lesion. And skin skin look for genthelesma and races, limb ischemia. These are the skin examination of a stroke patients. Genthelesma. Genthelesma is a sharply demarcated yellowish deposit of cholesterol underneath the skin. It usually occurs on a around the eyelids. And limb ischemia. Limb ischemia is a severe obstruction of arteries which markedly reduce blood flow to the extremities like hand, feet, and legs. Next one, eyes. Look for diabetic change. Look for diabetic change retinal emboli, hypertensive changes, arcus senalis, arcus senalis, retinal emboli. Retinal emboli are a opacities identified in retinal arteries and often incidental finding on ophthalmic examinations. And next one is Arias annulus. Arcus sinus is a half circle of the gray and white or yellow deposition in the outer edge of your cornea, the outer layer of the front of the your eye. Next one is CVS, cardiovascular system, hyper and hypotension. Hyper and hypotension, like abnormal rhythm, marasmus, raised and JVP, peripheral pulse and reversed respiratory system, pulmonary edema infections, in which marasmus raised a sound of blood flowing. Marasmus raised means sound of blood flowing through the heart due to anything from healthy heart acceleration during exercise to a diseased heart one or the abnormalities. And JVP. JVP means jugular venous pulse. And next one is abdominal urinary retentions and urinary retentions and locomotor systems. Locomotor systems injuries sustained during collapse with strokes. Comorbidities with influence functional abilities. Locomotor system is also known as muscle skeletal systems. Made up of locomotor system is like skeleton, skeletal muscles, ligaments, tendons, joints, and cartilage and of the connective tissues, also known as locomotor system. Next one is stroke warning signals. Stroke warning signs like sudden numbness, stroke warning signs like sudden numbness or weakness of the face. Sudden numbness or weakness of the face, arm or leg, especially on the side of the body, especially on the side of the body like sudden numbness or weakness of the face, arm or leg. Next one is sudden confusion. Sudden confusion, trivial speaking or understanding. And next one is sudden tribal seeing in one or both eyes. Sudden tribal walking dizziness, loss of balance or coordinations. Sudden severe headache with no known causes. Immediate cells like or the emergency medical services number so can ambulance ideally with advanced life supports can be sent for you, and also check the time so you will know when the first symptoms appear. It's very important to take immediate actions. If even within 3 hours of the start of symptoms, a clot boosting drugs called tissue plasminogen activators may reduce long-term disability for the most common types of stroke. Next one is assessment of a person with assessment of a person with suspected stroke and emergency supportive care, like emergency medical services. EMS means emergency medical services should be instructed in the rapid recognition, evaluation, treatment, and transport. Baseline assessment with minutes, Baseline assessment within minutes like CT scan. CT scans means computed tomography, ASAP. ASAP as soon as possible. As soon as possible and immediate evaluations of the following immediate evaluations of the following like ARV, vital signs, and general medical assessments. General medical assessments including evidence of injury, cardiovascular abnormalities, and what one is neurological assessments frequent and maintenance of adequate tissue oxygenation. Maintenance of adequate tissue oxygenation, protecting the airway, auto inhalations, and maintaining optimal blood pressures like autoregulations faulty or lost in stroke patients, autoregulation faulty and or lost in stroke patients. Next one, primary treat, primary and secondary preventions. Primary and secondary preventions like antiplatelets and anticoagulants drugs, antiplatelets and anticoagulants drugs, blood pressure lowering medicines, and next one is cholesterol lowering and cessation of smoking, teas, diet, and is exercise. These are the primary and secondary preventions for the stroke. Next one. Next one is management of a transient ischemic attack. Management of a transient ischemic attack, TIA. First one is medical management. First one is medical management, in which medical management, if diffuse atherosclerotic disease or poor operative conditions. First one is stop smoking. First one is stop smoking, and second one is concurrent medical problems. Concurrent medical problems to be addressed, and emboli from heart and other parts of cardiovascular system. Emboli from heart and other parts of cardiovascular system like anticoagulants drugs like heparin, IV use and warfarin used as orally, and second one is antiplatelet drugs like aspirin orally and tecloplidine, diabetes, hypertension, and hyperlipidemia. Diabetes, hypertension, and hyperlipidemic drugs are manage the transient ischemic attack. Next one is management of an acute episodes of stroke. Management of an acute episodes of strokes like airway, maintain airway and prevent aspiration, keep nil per oral, and breathing, maintain oxygen saturation greater than 9 more than 97% and supplementary oxygens. Next one is circulation, adequacy of pulse and blood pressure and fluid, antiarrhythmias and inotropes. Hydration, prevent dehydrations, give adequate fluids, parenteral or via nasogastric tubes, and nutritions like nutritional supplements and nasogastric feeding and medications. Administered medications also by route other than oral. Management of ischemic stroke. Management of ischemic stroke like thrombolytic and revascularizations, thrombolytic and revascularizations, TPA, tissue plasminogen activators like Alteplase 0.9 mg per kg, maximum 90 mg, and 10% of dose initial IV bolus and reminder infused over 1 hours and to be used less than 3 hours of onset of symptoms for maximum efficacy. Hemorrhage to be ruled out like neuroprotective agents like ginkgo biloba and panax ginseng, curcuma longa, Bacopa moria, and Stevia officinalis. These are the neuroprotective agents. Antiplatelets therapy. Antiplatelet therapy has been clopidogrel act by inhibiting aspirin and clopidogrel act by inhibiting platelet aggregations and adhesions. Aspirin 300 mg single dose to be given immediately following diagnosis. And if Alteplase given, it can be withheld for 24 hours. And later aspirin at a dose of 75 mg in combination with clopidogrel 75 mg daily for about 1 year durations. Next one is anticoagulants. Next one is anticoagulants. Heparins, warfarins act as a anticoagulant action. Heparin act by accelerating the inhibition of factor second and factor 10 of coagulation cascades, and warfarin antagonize vitamin K to prevent activation of clotting factor and decrease risk of recurrence and venous thrombolism and initial intracranial hemorrhage and intracranial hemorrhage to be excluded before therapy and more useful in stroke is evolving like hyperosmolar agents. Hyperosmolar agents are reduced cerebral edema. Hyperosmolar agents are reduced cerebral edema and 20% mannitol IV in 100 ml thrice in a day. Oral glycerol is swallow is normal. Concurrent medical problems such as arterial fibrillations to be tackled and others. Pentoxifylline to be used within 12 hours and neuroprotective agents. Next one is management of hemorrhagic stroke. Management of hemorrhagic stroke like control of hypertension, control of hypertension and control coagulation abnormalities, especially due to oral anticoagulants, especially due to oral anticoagulants and surgical decompression and surgery for aneurysm and arteriovenous malformations. Aneurysm means a ballooning often occurs in a arteries and arteriovenous malformation. Arteriovenous malformation and abnormal connection between arteries and veins, usually in the brain or spine, also known as arteriovenous malformation. These are the management of hemorrhagic stroke. Next one is secondary preventions. Next one is secondary preventions like blood pressure control, diabetes management, lipid management, smoking cessations, alcohol moderations, weight reductions, physical activities, carotid artery interventions, antiplatelet agents, and anticoagulants. statins, and diuretic used as a SC inhibitors, angiotensin converting enzymes. These are the secondary preventions for the stroke. These are the complications of acute stroke, like chest infections, epileptic seizures, deep venous thrombosis, pulmonary embolism, and painful shoulders, pressure psoriasis, urinary infections, constipations, depression, and anxiety. These are the complications of acute stroke. Next one is references like Clinical Pharmacy, 10th edition, 2010 by Binet Bennett, and Clinical Pharmacy and Therapeutic, 5th September 2001 by Roger Walker, Gete Legislation, and Pharmacotherapy and Pathophysiological Approaches, DIPRO, 7th editions, and Essential of Medical Pharmacology, Cadity Party, 5th editions, and Basic and Clinical Pharmacology, Vetram Geek, Get June, and 11th editions, and Dragon and Dial Pharmacology, 6th editions, and Pharmacology and Pharmacotherapeutics, RS Sotaka, 20 editions. These are the references for the stroke. Next one is multiple choice questions. Next one is multiple choice questions. Question one is stroke occurs when the blood supply to part of your brain is option A is interpreted or reduced. Second one is interpreted or increased. Option C is both A and B, and option D is all of the above. The right answer is A, interpreted or reduced. The stroke occurs when the blood supply to the your brain. TIA. TIA is a option A is transient ischemic attack. Option B is transferable ischemic attack. Option C, none of the above. Option D, all of the above. The right answer is A, transient ischemic attack. Next one is risk factors of stroke. Next one is risk factors of stroke. Option A is age and gender. Option B, excess alcohol consumptions. Option C, high blood pressure. Option D, diabetes. And option E is all of the above. The right answer is E, all of the above. Risk factors of stroke like age, gender, excess alcohol consumptions, high blood pressure, diabetes, all are the risk factors of stroke. Brain required constant supply of glucose and oxygen delivered by a option A is blood, option B is tissue, option C is body fluid, and option D is electrolytes. The right answer is A. Blood delivered the brain required constant supply of glucose, and oxygen. Next one question. How to examination of a stroke patients? Option A is neurological examinations. Option B, gentle asthma. Option C, abnormal rhythm. Option D, urinary retentions. And option E is all of the above. The right answer is E, all of the above. Next one question. What is another name for a stroke? Option A is heart attack. Option B, brain attack. Option C, myocardial infections. And option D, none of the above. The right answer is B, brain attack. Next one question. Which of these lifestyle factors play the biggest role in increasing the risk factors for in your younger adults? Option A is overweight. Option B is little or no exercise. Option C, high blood pressure. And option D is smoking. The right answer is D, smoking. If a person has an ischemic stroke, how quickly should two person be treated? to minimize long-term problems. Option A is within 30 minutes, option B within 1 hour, and option C within 2 hours, and option D within 3 hours. The right answer is D, within 3 hours. Next one question. Which type of medicine is given to help prevent a stroke? Option A is medicine to prevent clots from forming. Option B, blood thinner medicines. Option C, clot boosting medicines. And option D, A and B. And option E, all of the above. The right answer is D, A and B. Next one question. Which of these may be a long-term problem after a stroke? Option A is paralysis or weakness on one side of the body. Option B, problem with thinking or memory. Option C, problem with language. And option D, pain in the hand and feet. And option E, all of the above. The right answer is E, all of the above. Thank you. Thank you all of you for a wonderful session.